Welcome back to Summarize Science. Today, we are diving into an eye-opening study about the hidden security and privacy risks of medical AI chatbots. Many healthcare providers are now using a technology called Retrieval-Augmented Generation, or RAG, to provide patients with grounded health information. While this technology is meant to make AI more accurate, researchers found that these systems can expose sensitive backend data if they are not secured properly. The researchers conducted an anonymized case study on a real-world medical chatbot to see what an ordinary user could find. They wanted to know if someone using just a standard web browser could access information that was never intended for the public. To test this, the researchers used a two-stage strategy that combined AI-assisted exploration with manual verification. They actually used a different AI model, Claude, to help them brainstorm potential vulnerabilities and structure their testing. By framing their requests under a false developer persona, they got the AI to suggest prompts that could trick the chatbot into revealing its secrets. This shows that the same AI tools used by security auditors are also available to people with malicious intent. Once they had their hypotheses, they used the standard developer tools built into every Google Chrome browser to inspect the site's traffic. They did not need any specialist hacking skills. They simply looked at the data being sent back and forth between the user and the server. The results were alarming, as they discovered a critical architectural vulnerability where sensitive configuration data was exposed to the client side. This allowed the researchers to see the chatbot's internal instructions and exactly how it was retrieving information. Even more shocking, they found that the chatbot was storing the private conversation records of its 1,000 most recent users. These records included the full text of health-related queries, even though the system's public privacy policy claimed it did not store this data. Table 3 in the paper provides a summary of the massive amount of data that was retrievable without any authentication. This included API schemas, internal hostnames, and the full content of the source documents used to train the chatbot. This is a major concern because patients often share very personal information with chatbots that they might hesitate to tell a human clinician. If these conversations are stored without proper security, patients could be exposed to significant privacy risks. The researchers also found that the chatbot's personality prompt was actually very short and generic, despite being advertised as a purpose-built medical artifact. This highlights a major gap between the marketing claims of some AI tools and their actual implementation. To address these issues, the study proposes a set of minimum security expectations for any patient-facing RAG system. They suggest that developers should never transmit secret fields to the client and must require strong authentication for all data endpoints. The researchers emphasize that independent security reviews should be a prerequisite for deployment, not an afterthought. They argue that as AI tools become more common in healthcare, we must evaluate them as complex software systems, not just as language models. To recap, the main point of this study is that AI is only as secure as the infrastructure it runs on. If developers leave the backend exposed, even the most helpful medical chatbot can become a liability for patient trust. In the future, we can expect more rigorous standards for medical AI to ensure that patient data remains truly private. Thank you for watching Summarize Science, and stay curious about the technology that powers our world.